Hello, everyone, and welcome back to the Swalife Podcast Series. Predictive medicine is one of those ideas that feels obvious when you hear it, but it becomes surprisingly difficult to define when you apply it in real science, real drug discovery, and real clinical decision making. Some people think predictive medicine means early diagnosis, others think it means AI predicting disease before it happens, and many assume it's just another name for precision medicine. When you are working in complex diseases like cancer, or building AI driven drug discovery pipelines, or trying to prevent late stage failures in small molecule development and formulation, predictive medicine turns out to mean something far more specific and far more demanding. Today, we are going to unpack what predictive medicine really means, how does it work, why it matters now, and how Swalai approaches it across discovery, development, and decision making. I am joined by Dr. Pravin Badhe, who works at the intersection of artificial intelligence, translational science, and predictive medicine. Dr. Pravin Badhe, welcome back.
Thank you, Shruti. This is an important conversation because predictive medicine is not about technology alone. It's about how we think under uncertainty.
Yes, so let's begin with the foundation. What is predictive medicine?
Okay, so in case of predictive medicine, it is often misunderstood because people actually expect it to deliver certainty. But when we look at predictive medicine, it is not about knowing exactly what will happen. It is about anticipating risk, response, and outcome early enough so that way the decision can be influenced. So if you look at traditional medicine, it is largely reactive. So it wait for symptoms to appear, disease to progress, damage to become measurable. But predictive medicine is shifting this timeline because it is asking us that what is likely to happen next if we don't do nothing. Where is risk silently accumulating? That's the another thing it is asking. Then which intervention, if applied earlier, could change the trajectory? So predictive medicine operates in probabilities and not absolutes. So it does not actually replace the diagnosis or clinical judgment. It extends the decision making upstream. So before outcomes become locked in. So that's what the predictive medicine is.
Right, so predictive medicine is not about predicting the disease itself, but about predicting the decision.
Exactly. So predictive medicine predicts decision relevance. So it tells us which risks are worth acting on now, which signals are weak and need more evidences, which choices are likely to have long-term consequences. So in that sense, predictive medicine is not about prediction for its own sake. It is about better timing of action.
Conceptually, that is very clear. But how does predictive medicine actually work in practice?
Okay, so with predictive medicine, work through integration over time. So no single data set enables predictive medicine. What matter is the convergence of signals across layer, such as longitudinal clinical history, then molecular and biomarker data, then imaging and pathology, then environmental and lifestyle factors, also the real world outcome evidence. So individually, these signals are often weak or noisy. Predictive medicine become powerful when they are combined into the trajectory. So instead of asking, what does this snapshot tell us? Predictive medicine asks how this system evolving and where is it likely to go next.
Is this why predictive medicine depends so heavily on the longitudinal data?
Yes, prediction without time is an illusion. So medicine is dynamic, but diseases are evolving. So patient adapt, interventions interact, but predictive medicine work by modeling change, not statistical states. And that's why it is required continuous updating, recalibration, and humility.
That brings me to my next question. Why has predictive medicine become critical now, and why was it not critical earlier?
Because modern medicine has crossed complexity threshold. So we are now dealing with multifactorial chronic diseases, then massive biomedical data sets are available, then increasing personalized expectations are there, which is rising cost and failure rates. So human cognition alone cannot manage this complexity. So with the help of predictive medicine, provides a large it provides a way to scale reasoning, not just computation. So it helps healthcare move from reactive care to anticipatory care, late intervention to early risk management, and average based decision to probability awareness decision. Without predictive medicine, modern healthcare become unsustainable. So clinically and economically as well.
So let's focus on complex diseases, for example, cancer. How does predictive medicine fundamentally change how we approach these diseases?
Okay, as you have taken example of cancer, and we are also working on that. So cancer actually expose the limitation of this traditional medical thinking. It is a heterogeneous, adaptive, and context dependent. So if you take an example of two patients with the same diagnosis, it may follow completely different trajectory. So in the predictive medicine help oncology shift from what treatment do we give to what trajectory is this tumor likely to follow. So it helps anticipate resistance mechanism, then progression time, then toxicity risk, and the response durability.
So does this mean that predictive medicine is more about monitoring than actually treating?
It's about timing treatment intelligently. So predictive medicine does not reduce intervention; it improves when and how intervention happen. So it helps clinician decide who need aggressive treatment, who will benefit from watchful waiting, and who requires close monitoring. So this actually reduces the over treatment, under treatment, and unnecessary.
Yes, so let's take this to what Swalife does now. Swalife is working deeply in small molecular discovery and formulation science. Where does predictive medicine enter here?
So predictive medicine enter much earlier than most teams realize. So in small molecular program, predictive thinking helps to anticipate ADME variability, then exposure instability, toxicity convergence, and formulation fragility. So many late stage failures occur not because the biology was wrong, but because the real world behavior was never anticipated.
So predictive medicine applies even before our drug reaches patients.
Absolutely. If you cannot predict how a molecule will behave in real condition, scale up patient variability, formulation trace, you don't have a medicine, you have a hypothesis. So predictive medicine forces discovery team to think beyond idealized experiments and towards real user reality.
Now let's talk about a few terms that is predictive medicine, preventive medicine, and precision medicine. These terms are often used interchangeably. How do they actually differ?
Okay, so they solve actually different problem. So if you look at precision medicine personalized treatment based on biological differences, where preventive medicine aim to reduce disease occurrence, and predictive medicine anticipate risk and response to enable both. So predictive medicines is the connective tissue. Without prediction, precision become reactive, and preventive become generic. So prediction allows medicine to act before damage become visible.
That was a very clear and simple explanation. So let's move ahead to artificial intelligence. Artificial intelligence is often positioned as the engine of predictive medicine. Is that accurate?
AI is necessary but not sufficient. AI excel at pattern detection, then scale, then integration of complex data. But AI does not understand meanings or consequences.
So, where do predictive medicine efforts go wrong with artificial intelligence?
Okay, so many time with even with my team also when I'm talking that you are using AI, but you shouldn't actually just take those result and put into as a conclusion because AI outputs are treated as true, and there where actually the failure occurred. You should actually use it as a decision input. So predictive medicine require interpretation, it require context, and it also require ethical judgment. So AI must be guided, then it should be constant, and it should audit it. Otherwise, it is going to amplify uncertainty instead of managing it.
Right. So let's move back to what we were talking about Swalife Biotech. So how does predictive medicine fit into the Swalife AI discovery flow?
Okay, so in Swalife AI discovery flow, we do data science organizing inputs. Then we use those data into analytical identification where the patterns of the data is predicted, and then we go for predictive analysis model as outcome. After completing these stages, the predictive medicines is where the interpretation begins. So it translates the output into clinical meaning, then strategic decision and risk awareness action. So without predictive medicine, discovery stop at insight. With it, insight become foresight only.
This brings us to the predictive medicine prompt studio developed by Swalife Biotech. How does it operationalize predictive medicine?
So the prompt studio address the biggest bottleneck, that is the translation. So discovery studios are rich, but they are fragmented. So with the prompt studio uses AI as a structured reasoning engine, not just as a black box. So it extracts the context from the dashboard, map the biomarker to the clinical relevance. Then it also help in designing predictive response and the risk framework, and then the proposed trial and decision support logic. So, what once required weeks of interpretation has become structured, review ready reasoning. So, this is how the dashboard become decision.
Yes. So let's move to the last part of this podcast about careers. What opportunities are emerging in the predictive medicine field?
Okay, so when we look from the career point of view, predictive medicine is creating a new professional ID. So, majorly the key roles include predictive medicine scientist, then there is a translational strategy leads, decision intelligence analyst, then AI assisted discovery scientist, predictive formulation expert, and also AI interpretation and governance specialist. The most valuable professions will not just generate the prediction, they will decide what prediction mean and when to act.
Yes. So with this, we end today's podcast. Predictive medicine is not about predicting certainty. It's about making earlier and wiser decisions under uncertainty. So at Swalife Biotech, predictive medicine is not just a buzzword. It's the final layer where data, artificial intelligence, biology, and human judgment converge. Thank you, sir, for joining us today.
Thank you, Shruti. Predictive medicine work only when it is paired with humility.
Yes. And to everyone who is listening, please remember the future of medicine won't be shaped by those who predict the most, but by those who uh, decide most responsibly with what they can predict. Thank you.
Thank you.